Welcome everyone to the latest webinar with Gotham Plastic Surgery. Very excited to be here today with Dr. Philip Miller, and we are talking about NatraNose, unveiling the latest secrets in rhinoplasty advancements. So this webinar will hopefully help you understand more about rhinoplasty, what's possible, the techniques that are out there, and just all the advancements that have been happening. We're going to touch a little bit on revision surgery as well as non-surgical rhinoplasty as well. And before Dr. Miller gets started, I just want to make sure you all know who you are hearing from today. So Dr. Miller is a board certified facial plastic surgeon. He's actually double board certified, and that first he was certified as an ENT or an otolaryngologist. And what that means is that he has extra special expertise on the functionality, the function of the nose, which is of course a functioning organ. So he's going to speak today about rhinoplasty, but now you understand a little bit more about his background. Dr. Miller also, of course, does all sorts of facial rejuvenation. We've done many webinars on facelifts and neck lifts, as well as injectables and non-surgical techniques. And his practice is located in New York City, in Manhattan, near Midtown. And he also sees patients down in New Orleans, in NOLA. What do we say, Midtown? Is that the best city?
Yeah, I think that's fine. Yeah, I mean, right. Yeah, it's in Manhattan. And then in Manhattan, you have Midtown and Upper East Side and Lower East Side. But Midtown is where I am.
Perfect. So without further ado, Dr. Miller, please take it away.
All right. Risa, again, thank you so much for hosting this and for being such a terrific hostess or host-e. I'm not quite sure, but you do a great job in just collating and collecting all of the questions and at the end, putting it all together again. So thanks so very much for everything. And of course, also thank you to my staff, who is amazing because they give me suggestions and advice, and April, who helps put this presentation together, and Tanya and Zane and Adina and Jose and Clay and Jen. And if I forget anybody, Carmen, etc., I'm sorry. And Nicole, you guys are all terrific. Thank you for everything you do. So without any hesitation anymore, let me go ahead and get this rocking and rolling let me share my screen, make sure that everything works appropriately.
Perfect.
And does this look right to you?
This looks great, except for you could just move the little zoom thing somewhere else.
Let me get that out of here.
Grab it from the top, from the right, I think. Yeah. However you were grabbing it.
Yeah, I'm trying to move it out of the way.
See, guys, this is really live. This is not pre-recorded.
There we go. Okay, how about now? Is that gone?
Now I see it, but can you just click on the I am screen sharing? I don't know. I don't need that to show anymore.
Oh, wait a second. Yeah, I'm moving it down.
There we go. Perfect.
Moving it to a totally different screen. You know, there's the secret. I've got two screens. Okay. All right, everyone, welcome. We're going to talk about rhinoplasty and unveiling the latest secrets and some of the advancements that are going on. And you've all heard so much about liquid rhinoplasty. Liquid rhinoplasty is a way for us to change the way the nose looks by injecting some material, particularly filler, into the nose. Now, we can't reduce the shape of it, but we can change the shape of it by adding material to the depressions or any type of defect to fill that void. And here's an example right now where I'm basically, this individual's inhaling some it's a nitrogen gas, and I'm able to take her from looking like this, where there's an indentation here and an indentation over here, and giving her a nice smooth bridge of her nose. Or there might be another case right over here where this gentleman wanted his nose to be straight, and you can see there's an indentation here, another indentation. And in order to give that a straight looking nose, we just give some filler here and some filler over here. And it also changes the tip of his nose. But perhaps one of the more dramatic changes that you're going to see is this individual, and I'll even share with you what I did to her. Take a look. We did this imaging here. Here's before, and here's what we would ideally like to achieve. Not sure if I'm going to be able to do it, but this is what we're going to try to do right now using a liquid rhinoplasty. Here we go.
Oh my God, it looks so good. It looks
looks a lot skinnier too. Wow.
And I tried giving you a nice little tip. It's a little red right now, obviously, because I keep pushing on it, but yeah.
Oh wow, that's so nice.
See the little tip you get?
Yeah, I love it. It's better than the pictures.
Yeah.
Wow. I love it so
I'm
much.
so
Thank
glad.
you.
You're
Thank
very
you so
welcome.
much. I love my new nose.
There you go.
I love it. Oh my god.
Perfect.
So you see,
Thank you.
she has now not only a bridge, but she's also from the front view, as she pointed out, her nose from the front view appears thinner. Disregard the redness here. That's just temporary. And obviously it's because I kept touching the tip of her nose. But not only was I able to give her a straighter dorsum, a straighter bridge from the side, but a more narrow bridge from the front and a more pointed tip from the side as well, something which is somewhat tricky, but a lot of times it can be done. Now, sort of flipping the other direction, we've been talking about the tip, now we'll talk about the bridge of the nose, but keeping it relatively non-invasive. One of my favorite techniques, and I should actually put a little registered, I think I even trademarked this, it's called micro rhinoplasty. I love this technique. I've maybe shared with it before, but those of you who have a little bump, just a small little bump on the bridge of your nose, and if you want it removed, there's a great and easy way to do it, as I'm going to show you right
It's
now.
a little micro rhinoplasty where all I'm doing is making a little incision. I'm sorry, taking a little bump that she had right on the side of her nose down with this instrument right here. And it was funny because as I started getting it elevated, she started saying,
I'm breaking up with my boyfriend. He needs to come out of the nose. This bump is just, we gotta get over the hurdle.
she goes, take this out, I want it right now. So, this instrument, this is a little graphic for those of you who may not want to
Take
watch.
it out.
Okay, so I'm underneath her skin right now, and I'm sort of exposing the area, and there it is right there. And now I take our little device here. This is just like a little vibration. Hear that? Good. And I'm putting that right underneath the skin. And she's got a little bump on her nose.
Bye bye bump.
And what are you saying?
Bye bye bump.
Say bye-bye, it's going away.
Bye bye.
Now you thought, you originally said, is she gone yet, right?
Yeah, is she gone yet?
So I'm going to give you another case example in just a moment, but with this very simple technique, and clearly you can see the patient is awake, is communicating with me, totally numb in the nose itself, but we're able to achieve this using a micro rhinoplasty technique. Here's another example of an individual who had more of a prominent bump, but it was only really on one side of his nose more than on the other side. And you can see it quite clearly under the skin. Take a look.
Here we are doing a micro rhino, and you can actually see this small little bump. I've outlined it right here, and as I glide the skin up and over, you can sort of see what's sort of staying right there. It's this little bump that he's got on the corner, right sort of on the edge right here. This is the perfect kind of bump that's right, if you will, for a micro rhino. Take this little device, and here we go. Any discomfort?
No, sir.
Again, under local
Go ahead,
anesthesia.
I'm going to take your hand here. Ready?
Yep.
Go ahead, feel this.
Oh my god.
That's
Pretty
one of my
cool,
favorite
huh?
things to
Oh
do.
my god, this is crazy.
It's
Thank
all gone.
You. Thank you.
I love having patients just take their finger right afterwards. Of course, I change my gloves and I remain sterile, but I love having the patients just glide their own finger over their nose. They know exactly what it feels like.
Here
And
we
here
are.
it is to have it be removed. And, we can even do a little bit more of just small little bumps. We can get into a point where you can not only have a little bit of bone, but maybe a little bit of cartilage. You have to be careful about removing too much. You can get what's called an open roof deformity. So I am limited, but in this individual, there was so much sort of solid components here that I was able to reduce it.
Another version of how do you go from here to here? And the answer is a micro rhinoplasty. A micro rhinoplasty is a procedure done under local anesthesia in just around 30 minutes. And all I do is shave down the little bump. I use a special machine that is very small and just takes the bump down. That's it.
And that's it.
Another.
Okay. Now we're starting to now look at two very different other types of rhinoplasty that you may have heard of. One of them is structural. The other one was going to be preservation. Structural rhinoplasty is meant to sort of reduce what is there and then rebuild it again whereas preservation tries to maintain what's there, but remove what might be not contributing well below, and then sort of drop everything down. This will make a lot more sense when I explain, when I give you better examples. This is an individual who had a structural rhinoplasty. You can see that she had very wide tips. You can see the cleft in between both domes. You can see the large hump on her nose. And now it's turned into something much more elegant after we removed the bump and then slowly built up the bridge again, recontoured the tip of her nose, sent me a lovely, lovely note. And I love this result. So that's an example of a structural rhinoplasty. Here's another one, again, removing the bump in the nose, deprojecting the tip, giving slight rotation, giving more definition at the tip as well, allowing us to see just ever so slightly, a little bit more nostril show, more definition on the tip, raising of this region over here called an infratip lobule, so it doesn't plunge as much as you can see here on the side view, and you can see here on the front view. Just a little bit more of an elegant nose, but perhaps none as really just sort of, just spot on as this individual.
Look, this individual is now just around 4 weeks post-op. She came in with just a little bump on her nose, a little bit of tip definition that she wanted. Also a little too much white lip, so we did a lip lift on her as well. And here she is now 4 weeks post-op, looking what I think is amazing. I love her result. She has what I call a whisper of a scoop, not too much, but enough tip definition. At now 4 weeks, you can see that type of tip definition. And I think she's healing incredibly well. If you put your head up, you can't even see the incision line. That's healed incredibly well. I love this result. What do you think?
I'm obsessed. I really am.
I've always loved that result.
You like?
Yeah, I couldn't be happier.
What were you saying that a family member said? Something like,
They were in awe of the stitches with the lip lift. My mom was like, should I do one too? I'm like, do it all. Yeah,
of course, that's not a
everybody's
rhinoplasty,
super
but that's
impressed.
actually,
and that's great. And
what
also
that's
the
doing is
swelling, you were
addressing
saying you really didn't swell up that
I
much.
didn't swell up that much. Everybody was like, oh, I look so scary afterwards. And I was like, I was out and about. No one even, I got so many compliments, and I was surprised. I thought I would be so much more swollen than I was. And it was back to day, like right away. So it was great.
Well, you look terrific. You do. And thank you so much for sharing your story, because
okay, so that also involved a lip lift, which was to reduce the length, not on this individual, but on the prior one, to reduce the length here of her upper lip, which gave her more of a red lip as well, which complemented the tip of her nose quite well. Another example of a structural rhinoplasty after removing the bump and then rebuilding the entire bridge, also giving her some rotation over here. Let's listen in.
Dr. Miller here for Post-Op Thursdays. We have a 3-month follow-up right now in a patient who came in before, who had a little bit of a bump on the nose. Tip was a little big, wanted it more defined, wanted it to be removed. And here she is now 3 months post-op. Tell us how you feel.
I love it. I was just saying how natural it is. And I mean, apart from the fact that I still look like myself, but it's just much more sleek. But the big thing for me is I love to work out, and I was just saying how crazy it is that now I can actually do the exercises properly because I can breathe too.
The bridge of the nose is just absolutely beautiful, nice and smooth, and this looks just fantastic. I love it.
And let's reiterate again that this wasn't just about making her able to look a little bit better. It was also allowing her to breathe better, because she was having a real difficult time with breathing through her nose, and exercising was a problem as well. So in addition to giving her more of an aesthetic improvement, we also went ahead and gave her a more functional nose. Now, what happens when you have a projected nose with a little bit of a bump and also a retrusive chin? So you can see here that this is someone who needs a little bit more in order to give her balance, not only a little bit of a deprojection of her tip, a reduction of the bump on her nose, but also adding a chin implant here. That's a very, very common ancillary procedure to rhinoplasty. In addition to the lip lift you saw on the other individual, adding a chin changes the face from being completely sort of concave, if you will, to more straight, as you can see here on the profile.
Hey everybody, welcome from New Orleans. We are doing a post-op Monday from New Orleans. You see a patient pre-op, has the bump on her nose like that, a little retrusive chin and a neck, and here she is not 3 weeks later. The nose is Still a little swollen. It's going to be on its way down, but you can see a really, really nice profile. You can see that the chin is a lot more projected than it was. We did a little liposuction under the neck as well. How do you like it?
I love it. It's the best. I was washing my face and I do my skincare routine. Usually there's a bump here and I was used to it. So when I went to go do it for the first time, I was like, oh my God, I have my nose done. I love it.
Oh, that's great. Great. Excellent. All right. Hey, everybody, welcome.
Okay. Here's another individual as well who had a similar type of scenario. Let's listen in.
This Monday post-op, take a look. This individual had some widening at the bridge of the nose on the top, a little bit of a sort of hanging lower tip. She wanted the bridge more refined as well. And I love this result. It's only around 1 month post-op. Here she is. You can see that she's got that elegant kind of whisper of a scoop. The tip of the nose is still going to be a little bit more defined over time. And I caused one problem that she just told me about, and I feel really bad.
Oh, yes. So I had cat allergies before, but just a little bit, like Zyrtec would help. And now I breathe so good that I got to take a little bit more than Zyrtec. So yes, but I can breathe really, really well because with the deviated septum, I can only breathe on one side. So
here that, again, it was sort of twisted from the very beginning, sort of very, very asymmetric with indentations in the tip, a little bulbous. And now just that refined, fine appearance. I love it. Thank you so much for sharing. I really, really appreciate it.
Thank
you. This Monday.
So again, you can see that kind of treating both the aesthetics, but also treating the functional, even if it is giving her a little bit more problems now that she can breathe more and is a little bit more allergic to her cats. We can do this on women. We can do it on men. This is quite a significant change as well. You can see the bridge of the nose that's been reduced, the tip down here elevated. I think he sort of sums it up.
It just came off.
Wow.
He's got a little numbing medicine underneath his
wild.
nostrils.
So different.
Oh, it looks fantastic.
Wow.
The bridge is gone. The nose is center in the nose. I haven't taken the sutures out just yet.
So I haven't taken the sutures out. That's what I'm saying. So that's why there's a little cream there to numb. We don't put sutures in any.
The nose was a very handsome guy to begin with, but wide, then pinched, then sort of narrowly pinched with the hanging infratipolobule. No good tip definition point.
You can see that obtuse nasolabial angle.
Nice profile, really nice tip definition. And from the front, it's a little swollen now, but it's just coming down. Nice.
That's just 1 week post-op, but at the same time, it is only 1 week post-op, whereas the photograph further down here is a couple of weeks post-op. Terrific.
It just came off.
Wow.
Hey everybody, it's Post-Op Mondays. Can't wait to show you this wonderful case. This gentleman came in already handsome, but it feels like his nose is just not projected appropriately. At the tip of his nose has a little bit of a bump as well. So we were just sort of reshifting things, pushing the tip out, taking the bridge down a little bit. Here he is now. This is now 1 week post-op. Here he is. You can see that bridge is just nice and straight. The tip is projected over the bridge. There's definition on the tip that he didn't have before. Give me a smile. Most importantly, the smile doesn't come down.
That's one of the most hardest things to accomplish. Very happy that you're able to do that for him.
Tell everyone how you feel.
Feels amazing. Minimal side effects after the surgery. Could not be happier. Thanks, Fatima.
There you go. Hey, everybody.
And now we're going to talk a little bit about preservation rhinoplasty. Now, what I was saying before was in the past, what we were doing is taking the bridge down and then having to sort of rebuild it. I'll explain what I mean by that in just a moment. But now what we're doing is keeping the components or the structural components and or structural proportions here and relationships of all of these units up here along the bridge intact, and instead taking off the bone or the cartilage underneath and allowing the bridge to sort of fall back. It's a new technique. Well, it's not really that new, but it's becoming much more popular now. It was actually first recorded a long, long time ago and then sort of fell out of favor, and it's been brought back into favor. But you can really get nice bridge results by requiring less dissection sometimes and less trauma to the bridge of the nose.
Here, I'll explain it a little bit better. I told you I was going to. Here it is.
There's a lot of talk right now about preservation rhinoplasty. And what does that mean? What does preservation rhinoplasty mean? Well, first of all, it's for patients who have a bump on their nose and they want to take the bump down. They want to make their nose a little smaller. Well, there are a couple of ways to do that, and I want to use this illustration to explain the two different ways to do it. So we'll start with this. Let's imagine that you have a really long Q-tip and you want to make it into a shorter, smaller Q-tip, right? You want to go from here down to here. Well, there's two ways to do that. Let's take a look at option one. Option one is you break off the top of the Q-tip, right? Then you figure out how to get rid of the bottom of the Q-tip. And then you take the top Q-tip and you bring it down here. And sure enough, you've created a smaller Q-tip from a larger one, right? That's one way of taking a big bump and making it gone or smaller. You go underneath and take the stuff out and push it down. That's what preservation rhinoplasty is. The other solution, option number two, is what's called structural. Structural is sort of the other way that we've been doing it all along. And what that is you break it down here at the height that you want it to be. But when you do that and you throw the top off, when you do that, you'll see that, well, yeah, we have the right height, but we don't have the right contour. We don't have the same configuration. So now we have to go ahead and rebuild it. We got to bring in some cotton and we got to wrap that cotton around that piece of wood. And sure enough, we have the same thing. We've gone from something large to something small. So preservation rhinoplasty is preserving that wood-cotton relationship, but destroying the bottom portion and then figuring out how to drop it down. Whereas the structural one is saying, you know what, we don't need everything on top, right? We know how tall we want it to be. Let's get rid of that stuff. But we're left with something now that doesn't really look exactly like what we want. So now let's figure out how to rebuild it. Okay, so one is preservation, one is structural. I don't know if you could argue which one is less invasive. I don't know if you could argue if any one of these is less involved. I don't know whether or not you can even say that preservation rhinoplasty really is preserving, right, the entire structure, because in both cases you're breaking it and throwing something away. But the term preservation rhinoplasty really specifically refers to the fact that you're preserving this relationship. And once you figure out how to get it down to where you want it to be, you don't have to rebuild it. There's a lot of talk.
Okay, another kind of functional component that we're going to address during rhinoplasty after we've taken the bump down, after we've fixed that, before we get to the tip, we want to make sure that people can breathe well through their nose. And you may have heard a lot of times called a deviated septum. Well, the septum is the partition between the right and the left nostril, and it's typically a wall. And that wall sometimes can be bent. And here I'm demonstrating two very, very extreme cases of patients who have a deviated septum.
Here's the septum, the partition between the right and the left nostril. It's just a piece of plastic, but sometimes it can be off to the left, sometimes it can be off to the right or so. But occasionally it can be bent so severely that it actually bulges into one of the sides. And that's what we have today. And this poor individual had such a difficulty time breathing through his nose because instead of this piece, which should be really thin, it just completely bulged all the way out into one side. You can see this area right there, it just completely bulged. This is one section. Here's another section. Okay, it should be this thin all the way down, and take a look right here. It just comes out.
It's almost perpendicular.
Poor kid could not breathe.
And here's yet an even more extreme
Some people
example.
think that a deviated septum is the partition between the right and the left nostril that's shifted to one side or the other, or maybe it's twisted like that, or maybe it's curved like that. But sometimes it can be like this patient where what should be nice and thin instead is really just incredibly thick and actually bows out onto one side. This is the person's bony septum, and it goes out, it's incredibly thick, and it just bows out into one side that was completely obstructing this person's ability to breathe. Here's the, some people think
And
that
now how do we go ahead and treat something like that? And we treat it either by just sort of breaking it off, but there's a really cool way to do it, also using a tool similar to the micro-rhinoplasty, and that's by technically actually just shaving it on down.
So we've talked about deviated septums, or partitions between the right and the left nostril that's off to the right or to the left, and that I've removed them. I've shown them to you in the past, right? But there's another way to treat it, and that is this wonderful device is like a drill, and I can actually use it to slowly sort of shave down the bumps or irregularities, and that way I just smooth it without actually removing it, and it keeps the integrity of the septum.
Well, after we do all this, unfortunately, sometimes things don't go all proper. And we're in the need for revision rhinoplasty. I see a fair number of individuals, unfortunately, for revision rhinoplasty. Fortunately, they're not my own patients most of the time, vast majority of times, if not most of the time. They're from other practices and from years to months ago. And we want to wait anywhere between 6 months to maybe a full year before we do any type of revision rhinoplasty. But yeah, we have to go ahead and revise things sometimes because you get a number of different problems, like this individual who had asymmetry of her nostrils with the tip itself, which really wasn't very contoured quite nicely. And I think I explained it better.
Great case for you. Come on over here. This individual had had some trauma in the past and rhinoplasty in the past, but was still left with some asymmetries. You can see one dome is a little higher than the other ones. There's some nostril asymmetry, some overprojection of the nose, and overall sort of poor definition. Here she is now, what is it, 2 weeks?
2 weeks.
2 weeks post-op. And you can see we've got a lot more refinement of the nose. We have really nice bridge tip aesthetics. We've got much more symmetry of the nasal base. Still a little red, granted, it's only been just 2 weeks or so. How are you feeling?
I feel great. I can finally breathe, and I cried the first time I actually could breathe fully. It's amazing. You did a fantastic job. I've never been happier.
You have a great case.
So, and I apologize why the video is sort of, for some reason, this presentation, the video is just sort of keep popping up 2 times. So I apologize for that. Another issue that can occur during rhinoplasty is that there's just not enough of this component of the bridge taken down and too much of this component taken down. You saw that with liquid rhinoplasty, that I can fill that in, but it also can be done using cartilage and shaved cartilage to treat an overscooped nose. Or in this case, you have an individual where too much was taken down in this region. So you had a retraction of the retraction of the ala, and then not enough was taken down here. So you have this infratip lobule as well as hanging columella down here. So an adjustment to that particular area will give it much more symmetry, a lot more proportion. Also in this individual, too much of the bridge was taken down and the tip itself was not properly projected. And so you can see here we've added something along the bridge, given the tip more definition by giving it more of a pointed look as opposed to this sort of round oblong kind of appearance. And though I don't think that this appearance from the side view may be as profound to you as the sort of warm feeling I have in my heart for this individual who was so unhappy and could not breathe out of her nose. And when I went ahead and just made her nose able to be functional and working, and at the same time rebuilt the bridge of her nose so that it was nice and strong and she had a nice normal appearing nose, well, she was just so delightful and so grateful. It still warms my heart when I think about that. I hope you enjoyed this brief presentation on rhinoplasty and what is available both in terms of liquid rhinoplasty, micro rhinoplasty, structural rhinoplasty, preservation rhinoplasty, all that can be done, including revision rhinoplasty. You've also seen a lot of the outtakes from my social media. Please feel free to follow me. I really love teaching, as you could tell by my videos. I love explaining things. I've always felt that if someone doesn't understand something, it's not because they're not smart, it's because the teacher didn't take the time to understand why they couldn't understand it or to explain it in a manner that made sense to the most number of people. So I do love teaching. And speaking of teaching, my next webinar will be, please save the date, That'll be on Tuesday, August 15th at 6 o'clock. That's Eastern time. For those of you on the West Coast, if you want me to do a later webinar so you can be here to ask your questions live, by all means, I would be happy to do that. Just let us know. Otherwise, of course, you can watch all of my previous webinars by just looking at the QR code right there, or going to my YouTube channel, and that's Dr. Miller. I'm sorry, Dr. Philip Miller. Where is it? I think it's, is it up here somewhere? Yeah, it's Dr. Philip J. Miller. That's the handle on YouTube, on Instagram, on Facebook, and all of the like. So that is it, Risa. I hope that I was able to shed some insight and light onto the fascinating world of rhinoplasty. You know, I love rhinoplasty because it's like a chess match. You know, it's, I do one maneuver, the patient responds, they go ahead, and then I do another one and they respond. And no two rhinoplasties are alike, both in terms of the results, but also in terms of the actual procedures and executions that I need, the techniques that I need to employ. And that's why it's always a thrilling operation for me, and one that I'm very fortunate enough to have dedicated my life towards, in addition to obviously some of the other facial plastic surgery procedures, but rhinoplasty in particular. So with that, I'm delighted to take some questions, and then we can go ahead, because the night is moving on. So we can also give everyone their notifications and get them out for dinner or home from work or wherever.
Exactly. Perfect. So we'll open up for some Q&A right now. So if you guys want to go to the feature on Zoom and pop in any questions, we'll get to those. And then we will do our giveaway for our grand prizes. So stay tuned. All right. So first question, can a rhinoplasty be used only to remove a bump and not anything else?
Yes. I think that was one of the points of the microrhinoplasty, is that a lot of patients, hey, they like the tip of their nose, they like the way it's projected, which means sticking out. You know, if it's too projected, that's Pinocchio, right? And then deprojection means it's further in. Rotation is how much it's tilted up, or deeper rotation is how much it's sort of tilting down. But they like that. They like the shape of the nose. They like the projection, the rotation. They like everything about it, but they have this little bump. And so if you're a candidate, you can absolutely get not only a rhinoplasty, you could get a microrhinoplasty, where it's really quick. 1, 2, 3. You saw 3 examples. We have many more examples for you to see how quick and easy it is. And just reducing that bump on the bridge is absolutely possible.
Yeah, absolutely. Okay, great. So quick question that someone asked is, when is the date for the next webinar? I can help with that one. It is going to be August 5th at 6 p.m. East Coast time, 3 p.m. Pacific. So the same as it was today. And the topic again is all about revision surgery. And basically, you know, why getting your first surgery right is important, but also there are a lot of people out there that may, you know, need revision surgery for one reason or another. So Dr. Miller will.
And I think at that time we will talk a little bit about how do you choose a surgeon. And you don't choose them because they've got the greatest number of followers on Instagram or the greatest number of followers on Facebook, or, you know, and it's not because they're not because you just think that they're nice individuals either. And I hope you think I'm a nice individual, but we'll go over the features about what I think you should use to choose your surgeon. And I think that'll be a good topic as well.
Absolutely. Okay, here's some great questions are coming through, guys. So can a tip rhinoplasty be performed under local anesthetic?
Yeah. So a tip rhinoplasty is such a huge umbrella. It can be just making a minor modification to this area right here. By the way, the technical term of this area is called the ala. All right. It can actually be a minor component of right here called the super tip or the infra tip or the tip itself. So for minor things, yeah, you can absolutely do it under local anesthesia. And even for some more major things, you can do under local anesthesia. Why do we prefer to do it under more sedation? For 2 reasons. One of them is it really hurts to inject the nose. There's no doubt about it. I mean, it just is uncomfortable. And I can put a lot of numbing medicine in there, cream that is, as you saw in that gentleman that the video was that I showed you, you know, so I can try to numb it, but injecting the tip of the nose is in and of itself uncomfortable. And then, although just a tip plasty alone typically wouldn't be an issue, You always have to be concerned that you're lying on your back during rhinoplasty, and any blood's going to drip down the back of your throat, and possibly you would inhale it, and that's potentially dangerous. So it's more due for the purpose of protecting your airway and making sure that you don't inhale any small little blood droplets than it is necessarily because it ends up being the procedure itself so painful, the injections to make it numb aside.
That's so interesting. Okay, that's helpful. So in what cases do you have to break the nose versus not break it?
So the breaking the nose involves manipulations of really just two areas. One area is if you take your finger right now and you glide it, let's take two fingers and glide it along the bridge of our nose. That's the bridge of the nose. And now I want you to take both of your fingers and slide it down your nose until you hit your face, right? And when you do that, that's your facial plane. And if you feel like the facial plane or where the nose inserts onto the face is too wide, the way you make that more narrow is by breaking the bones in order to bring that part of the bone further in. Well, what would be the other indication? The other indication is if, sliding your fingers back up towards the bridge of the nose, if you have a bump here, after you remove it, you can get something called an open roof deformity, whereby sort of like you've taken the top off of a box and now, yeah, you have all sides and the bottom, but you have no cover anymore. So you need to sort of bring the sides in to create a cover, again, to create that natural contour. That's the other reason why you have to break the bones.
Interesting. Okay. And will someone know if that's what you're going to do before you go into the surgery?
Very often we can discuss that and you can know that. And a lot of times patients have told me, don't break my nose. And I'll be like, no problem. I won't break your nose. And if there is a significant limitation on the results that they want to achieve by putting that restriction on me, I'll convey that to them. But usually, at least after 30 years, I know pretty well what I can and can't do with that limitation.
That's really helpful. And I guess that's just a reminder to everyone about how in depth Dr. Miller goes to really make sure that you're aligned before going in the operating room, because it is a little scary for those of us lay people, be asleep, not know what's going to happen. So that's really helpful to hear. All right. So a liquid rhinoplasty, you talked about a little bit. How long do those last, the results?
They last around 9 months or so. It depends upon what's being injected into the bridge of the nose. Look, back in the old days, a lot of people were injecting silicone and that lasted forever, but I wouldn't advise that right now. And I don't think that's necessarily a great idea. I love using the hyaluronic acids, which is what I use, and that lasts around 9 months or so. The best part about these injections is that if something goes wrong or you don't like it, it can be reversed. I can inject material that dissolves it. That's what I love about it. You use other long-standing material. If it doesn't get injected in the right place, there's nothing you can do about it, or it could be permanent without surgical removal.
Interesting. So does that mean that for some people, you could potentially do a liquid rhinoplasty first and make sure they're happy before you do a more permanent rhinoplasty?
Yeah, in fact, that's often what I do, whether it's with rhinoplasty or sometimes cheek, chin, jaw implants. I'll actually inject that with either water, saline, sterile saline to give them the idea of what it looks like, or if they want, with filler in the cheeks, and the jaw and the chin area to give them an idea of what implants would look like, which are obviously permanent. I would do the same for the nose, inject it, give them a good indication. Now, remember though, liquid rhinoplasty is only for adding, right? It can't subtract. So if you're wondering what you look like with a straight nose and you have a bump, I can give you that impression most of the time. I can give you that impression, but it's going to look like a bigger nose, right? You'll still get the straight view from profile, but it will be bigger. Whereas in a rhinoplasty, I can take the bump out. And so you have that same straight appearance, a little closer to your face, and the nose is smaller.
Very interesting. Okay, we already talked about what can be performed under local, but specific question, can an alar, I hope I said that right, alar rhinoplasty be performed under local?
Absolutely. In fact, alar, so let's talk about that. Alar rhinoplasty is when you start manipulating this portion of the nose, either here or over here, whether or not you want to bring it in, whether or not you want to flatten it, a whole bunch of other techniques. And that's one of the most irreversible maneuvers in rhinoplasty. And I explain that to my patients. And here's sort of the agreement the two of us have. If I really think, and I ask my patients to trust me, and they do, I said, if I really think that you're going to look the best by removing that tissue, by performing the alaroplasty, I'm going to do it. With your permission, I'm going to do it. If I have any doubt, if I think, you know what, maybe they don't need it, maybe they'd be happy without it, then I don't do it. And then the two of us decide after everything is healed whether or not you really want to have it done. And then if you want it done, it can be done under local in around 15 minutes in the clinic setting, doesn't require an operating room, and it can be simply removed and so sutured closed. And again, now the sutures are dissolvable anyway, so you don't even need to have the sutures removed.
Interesting. All right. So this woman said, my son had an alar rim reduction and he hates the triangle shaped nostrils. Is that fixable?
This is why I was mentioning alaroplasties are irreversible, because they are very difficult to fix. Now, that doesn't mean any one particular defect or deformity can't be adjusted or improved, but overall, they tend to be in that category where they are more potentially difficult. So I would have to see what it looks like. A lot of times doing a scar revision or placing in a graft or doing other techniques can, if not improve it significantly, at least make it look a little better.
Okay. And since you attended this webinar, you get a complimentary consultation.
Right,
So
right.
I guess you can send in photos and get a personal opinion about your son. Here's another interesting question. Can you do a nose job after a lip lift, or would it disrupt the lip lift?
Yeah, great question. That's a really great question. Now, for those of you who are not familiar, and I did have one case where I showed you a lip lift, not all of them, but many lip lifts require an incision that goes right along or right underneath here. Okay. It's called a bullhorn or whatever. You take out a little bit of skin like this, and then you close up the skin. That shortens the white lip. It everts the red lip. But if you think about it, you're actually now potentially pulling down on the tip of the nose. And so there is a trick to doing the lip lift so that you put in some deep sutures to prevent the tip from falling down. And as long as you don't make certain other incisions, you can do the lip lift incision and an external operation or an open rhinoplasty where you put an incision right along the columella here, which is right between the nostrils. So you can make that incision between the nostrils and one right along the base of the nostrils as well. And they both heal beautifully. You have to be careful. You can't make or can't put other incisions, but you can do those two together and it heals beautifully.
So interesting. So I think a lot of people tuning in today are from out of town. Can you go over, how does it work if you're out of town? Do you fly in just for surgery? How long do you stay? Is it a big deal? Do a lot of people come in from out of town?
Yeah, and we've been treating patients for rhinoplasty, and for that matter, even facelift and brow lifts and eyelid surgery out of town way before COVID hit. I just think it's so funny because now everyone thinks this whole notion of Zoom and doing video conferencing is all novel, and we've been doing it for 15 years. There was, what was it called again before Zoom was really hot? It was Skype, right? You know, we did it on Skype, and then before Skype there was something else. So we've been doing it for years. And what we do is simply have you stay in a hotel at wherever you feel most comfortable. We'll Zoom with you. We'll make sure everything is comfortable when you often come in the day before or the morning of surgery so that we can meet and talk. We will not proceed with the surgery until you feel comfortable. And if that means wanting to talk to me for another 20 minutes or 40 minutes before we walk back to the operating room, that is fine. People often wonder, hey, you know, how much time do I need to spend with you, Dr. Miller, if I'm coming from out of town, before I should allow you to operate on me? And my answer is very simple. If you feel confident that I have heard what it is that you want to achieve, and you feel confident that I've heard it, that I am on the same page with you and that I can achieve that, that's about as much time as we need to talk to one another. If you don't have that confidence, don't proceed. Do not have the surgery. Let's talk some more, postpone it, whatever it is. But I want you to have that confidence in the operation and in your vision and in knowing that you've communicated and I've heard that vision. Most often, Risa, the patients can stay here for 1 or 2 days and then go home, and I can have the cast be removed either by a colleague in their hometown, or nowadays, since most of the incisions actually dissolve by themselves, we give them instructions on how to take the cast off at 8 days. Alternatively, or 7 days. Alternatively, they can stay here in New York or down in New Orleans for 7 days. I can take the cast off, and then they could head home after that.
Got it. And would it be safe to even travel internationally on a flight?
Yeah, it really is. I mean, the biggest risk for this is simply swelling and potentially bleeding. And the greatest risk of bleeding is in the first 24 hours and then at around 7 to 14 days or 10 to 14 days afterwards. So as long as you don't you're not flying during those peak periods, then the biggest real challenge you have is the fact that when you go up, your nose is going to swell up, but then the moment you start descending, your nose is going to become less swollen, and it will be very similar to what it was right before you took off. And then within a day or two, it's right back to a rapid decline in swelling and black and blue.
That's so helpful to hear. And we actually have someone named Deborah who commented, so you all can see. She said, I came in to see Dr. Miller from California. His team made it so easy. My surgery was amazing.
Thank you, Deborah. And I hope, by the way, your pictures look amazing. They look amazing, amazing, amazing. I am so happy for you.
And Deborah, I'm in California too now, so hi. All right, a few more questions and then we'll get to the winners and let everyone get on with their evening. So if we need a revision septoplasty, can that be done with an alar rhinoplasty to make a wide nose more narrow?
Yes. They're really, even though they're right next to one another, you've got the septum right in the middle and the ala right here. They are, for all intent and purposes, it's like asking if you could have a neck lift and an eye lift. There's no bearing on the two. Yeah, they're next to one another, but they have, otherwise there's no limitation of one exerting itself on the other.
Got it. Okay. And the hottest question, of course, everyone's burning question to know is, what does this cost and is there financing available? Is there any guidance you can give us?
Yeah, I love to keep the whole financial question to my dear, wonderful patient coordinator, Clay, because it does change depending upon if it's a primary or if it's a revision or if it's a multiple revision or if it's just a micro rhino. And so it does change a little bit. I'd ask you to reach out to Clay. That's simply patient advisor at GothamPlasticSurgeryNY.com. That's Clay. No, patient coordinator, right?
I'll pop the email in right now for you guys.
Yeah, I think it's patient advisor. Patient advisor. There you go. Patient advisor at GothamPlasticSurgeryNY.com. I think you can even put in welcome at GothamPlasticSurgeryNY.com, and that would work as well. Should make it a lot easier for patients, or just text. You can text us at 212-750-7100. That's texting at 212-750-7100. And we'll be able to get back to you by text. We try to make it as easy as possible to communicate with us, not only as prospective patients, but also obviously as our existing patients.
Perfect. Okay, few last ones. So, do you offer financing? Do you know, or should we ask Clay?
We do. Yeah, we definitely do. I think there are two financing options that are very common in the cosmetic surgical world. And I believe we participate with both Care Credit and then Alpheon, I think is the other one.
Yes, Alpheon. Yes. All right, perfect. Thank you. Okay, so I've researched doing a rhinoplasty 25 years ago, and one of the reasons I didn't do it is I was deterred by having the packing in for several days. Is that still something that's done?
No, it's not. You know, I know, isn't that crazy? But so on one hand, you were smart to defer it for 25 years because it's probably the one thing everyone who had their surgery done 25 years ago remembers. And I would say it really makes them question whether or not it was worth it all those years, because that's what they still remember. But no, you do not have to have your nose packed at all now. You probably didn't need to have it packed then either, but no one knew any better and you just did what you were taught. That's really why we did it. But now what we'll do is I'll put small little dressings on the inside of your nose. And primarily it's just so that when you wake up, if you sneeze or if you cough, you don't honestly spray some blood, your own blood, onto the anesthesiologist or some of the other operative team members. And then the moment you're in the recovery room, we slide them out. You don't even recall having them in your nose. And again, it's not packs. It's really just sort of very light dressing to absorb any blood that might accumulate in your nose.
Perfect. Okay, and last one for our rhinoplasty revision. I am looking to elevate the bridge and have an alar reduction. Can this be accomplished in a micro rhinoplasty?
Great question. No. So a micro rhinoplasty is really simply reducing a particular bump. What you're asking for is to elevate the bridge of the nose, or that's what I'm hearing, right? Risa, did I capture
Elevate
that
the
right?
bridge and
Yeah.
have the alar reduction.
Right. So the alar reduction, yes, we can do under local, and depending upon what option you choose for the bridge augmentation, because, and there's nothing wrong with this, one option for doing that is just sliding in a implant made from a number of different sources. But if you choose to just have an alarplasty and a little implant, by all means, that can be done under local anesthesia.
Got it. All right, perfect. Well, I think we answered all of everyone's questions today, which is fantastic. Before we get to the winners right now, I want to remind Dr. Miller to check out the chat really fast, and for you guys to all mark your calendars. August 15th, everyone get out your phones. Let's put in a reminder here. August 15th, 6 p.m. Eastern, and we're going to be going into detail about revision surgery and, like Dr. Miller said, also about how to choose your surgeon. So whether you come with us or not, we're going to provide a lot of information, and revision surgery is definitely more complicated than primary surgery, we call it. So Dr. Miller is a very good person to hear that from. Any final questions? People are just saying, thank you so much. You did an amazing surgery for my daughter, someone else said.
Oh, I'm so glad. Thank you. You know, that really makes it all worth it. It really does. I'm very grateful for that. And I love doing what I feel so much. I feel selfish sometimes because I love doing what I'm doing. And then I got to remember, wait a second, no, it's not about you, Phil. It's about making sure they're happy. And I love hearing that I am actually accomplishing that, but I so enjoy what I do that I can sometimes be consumed with the joy of just performing the procedure.
Well, it's very lucky, and I'm grateful I even get to work alongside of you and help make people happy. And you guys, I mean, we share some of it on social media, and we've shared some of like the cast reveals, but there are so many more that we don't get to share publicly. It's really inspirational. You know, it's a big part of our why we do this.
Right. Yeah. A why.
All right. So for our winners here, let's get started. Drum roll, please. We have system. All right, the first one is Belissa.
Belitza, welcome.
Yes, welcome. We're excited to hopefully meet you. The second person here is named Amy. Amy, you are winner number 2. And the third one is Jennifer.
All right.
Jennifer, thank you so much. We really appreciate all of you. Those of you, we only said your first name, but we will be reaching out to you privately tomorrow to let you know. And I really hope all 3 of you can use this credit towards surgery with Dr. Miller. But everyone who came today is eligible for a complimentary consultation. So I don't see any reason why you shouldn't all sign up for some one-on-one time with Dr. Miller, especially because you can book online now on the website if you would like on your own, or you can text or email the numbers that I put in the chat. So without, I think that is where we're at today, and I'm very excited. This is really great to hear from you, Dr. Miller. Thank you so much. I know Dr. Miller had a ton of surgeries today, and he has a very busy week, and I'm just really grateful he had enough bandwidth to educate us all today.
I love doing this. I love educating, and it's a really great opportunity to meet new people as well as answer questions, which I think sometimes are left to be answered. So I'm happy to have done it.
So
Yeah.
Reese, again, thank you so much for taking the time and once again hosting tonight. For all of you, I look forward to seeing you in consultation. Please reach out to Clay. Join me or follow me on Instagram and all those social media channel things, because I do like posting a number of educational
Yeah.
series as well as great cases. So with that, I want to thank everyone for coming tonight. Reese, again, thank you so
Yes.
very much.
So good night, everyone. And we hope to see you all soon. Thank you.
All right. Good
Bye.
night. Bye-bye, everybody.